Hello all. Hello all. We're going to discuss a few tricks to differentiate some GI infections. Especially we'll be looking at protozoal infections rather than the common Giardia and Entamoeba. We'll not be looking into those. So what are the commonly confused protozoans? Microsporidia, Cryptosporidium, Cyclospora and Isospora. Isospora is also known as Cycloisospora. This one is Microsporidia. As you can see here, there are very small some organisms in the epithelium. So Microsporidium is an intraepithelial organism. Okay, very small. Sometimes this can easily be missed in H&E. So it's important to do strains like GIMSA, where these organisms can be highlighted very easily, as you can see here. Okay, so this is Microsporidium. Here what we see, this is Cyclospora. Cyclospora again is an intraepithelial organism. Okay, and what you can see here are two forms of this organism. You can see that there is a single unicellular form of the organism, and here you can see a sporozoid. So both of these forms can be identified in Cyclospora, and usually you see it in the upper part of the epithelium, the upper half of the epithelium. As you can see here, the merozoans are the ones which are crescent shaped, and they are usually unicellular, single cellular organisms. Probably unicellular gametocytes can also be seen, and the ones which are dot-like like these are the schizons. So these are the forms which can be identified. Then you can notice that there is a vacuole. You see an organism here, and surrounding that you see a vacuole-like area. So this vacuole is known as a parasitophorous vacuole. So what is a parasitophorous vacuole? Parasitophorous vacuole is nothing but a vacuole which the organism forms around itself to evade immunity. For example, if you have an organism, the innate immunity is going to get triggered and macrophages will be activated to engulf the organism. To avoid this, there is a vacuole which is formed around this. So Cyclospora, you can see a parasitophorous vacuole. This is what you can see. This is not an entirely intracellular organism. You can see that these are the epithelial cells. This is the nucleus of the epithelial cells, and you can see that the organisms are stuck onto the epithelial cell surface like this. This is what, and usually these are basophilic organisms. This is what you see in Cryptosporidium. So this is Cryptosporidium, what you see here. These organisms are not entirely intracellular. You can see that these organisms are present over the epithelial cells, stuck onto the epithelial cells. Sometimes these might be missed in H&E very easily. So what is the diagnosis? The diagnosis can be done by using the stool test. So sometimes these oocytes of Cryptosporidium can be present in the stool like this. And when you stain it with AFB, these might get highlighted as you can see here. And if it's not evident in stool, always a PCR can be done for detection of these organisms. Next one here, this is Isospora. Isospora is the largest of these organisms. You can see how large these are. This is an intracellular organism, and unlike Cyclospora, you can see that these are found in the bottom side of the epithelial cell. And like Cryptospora, like Cyclospora, you can see that there is a vacuole around this. So we can see these parasitophorous vacuoles in Cyclospora and also Isospora. Okay. So this is something which is very easy to remember. Remember this chart where you can see that these are how the organisms look. So this is intraepithelial, Isospora, large organism, parasitophorous vacuole. Okay. Similarly, Cyclospora, again vacuole, schizon form, also unicellular forms like these. And Microsporidia usually intracellular, small organisms, and Cryptosporidia present above the epithelial cells. This is a quick chart which you can always go through to identify these organisms. Most of these organisms can be identified by acid-fast stain. Acid-fast stain is usually done in the stool samples. GIMSA can be used to identify Microsporidia because it's very easily missed in histopathology, and mostly you can have a normal report, but instances where we need to be extra careful is when we are dealing with an immunocompromised patient. Thank you.